Hello, Dr. Crockett and Dr. Crocker here with Zeal Integrated Health, and today we're going to talk about myths of diabetes. There's several thoughts out there about diabetes, and I hear it all the time when I talk about what I do, and they go, "Well, that's got to be really easy. You just tell them to get the fork out of their mouth. Change the way they're eating." Unfortunately, these myths create problems with having real success with this disease and reversing it. So the first myth that I want to talk about is the fact that it's not reversible. We see our patients every day be able to reduce their medications, eliminate the need for these medications, and bring their A1C back under into a normal range, under a 5.7. So we know these things can be done. The literature's out there, the science is out there, and there's a lot of stuff online that confirms these things. The other thing that gets blamed a lot for diabetes is that it's just weight driven. And unfortunately, weight is really the product of a broken metabolism. So ultimately, weight is a symptom of diabetes. It's not the cause of the diabetic process. So a lot of times people, they go to their doctor, and what's their doctor tell them? Well, you just need to lose 20 pounds. You need to lose 30 pounds, and your numbers are going to be better. But unfortunately, I've had people lose over 100 pounds, and their A1C goes up. So we know that weight is a reflection of the metabolism. What are some of the other myths about diabetes?
So some of the other myths is one of them is genetics. A lot of patients like to come in. They say, well, my dad had diabetes, my mom had diabetes, so it just runs in my family. That's just something that's going to happen. Well, that is one of the myths that we find that doesn't happen that way. Just because your mom had it, your dad had it, doesn't mean that that's something that you're going to do. A lot of times we find it can be a lifestyle trail that you followed. Can be something that your family's done, so you've done, and it just kind of led you down possibly the wrong path, and you end up in a situation of diabetes.
Yeah, there hasn't really been a gene that's been associated with the genetics causing diabetes. We found that it is more the environment that you're brought up in and the lifestyle things that you've developed.
Yeah, and the other one that I really see a lot is exercise. We have lots of patients that they go to their doctor and they say, well, you just need to exercise. Well, unfortunately, many times with type 2 diabetes a lot of patients are overweight. They have trouble with their joints. They have problems with their body, and they can't go out and exercise. They can't do those types of things. And exercise is not something that causes diabetes to go away. I've actually had patients come in. They've exercised. They tested their blood sugars before. They've exercised. They tested it right after exercising, and their blood sugars went up. So that can mean to me that you're not healthy enough in order to exercise at this point. That doesn't mean exercise is not the best for you, but at this point, you're probably not, exercise is not the best for you.
Yeah. So we see that some things can be inflammatory in the process. Exercise can be that inflammatory driver that drives those blood sugars up. And unfortunately, some people can't tolerate that. Yeah. So there's certain limits. The other thing that we hear about is people come in and they're like, well, I'm on insulin. Is there any way you can help me? One of the myths is once you're on insulin, that you're always going to be on it. It's a point of no return, and that's not true. We see people get off of insulin all the time in our clinic with our clinical approaches. So just because you've been put on insulin, don't think that that's maybe what you have to stay on the rest of your life with your condition, with your diabetic condition.
The other one we'd like to talk about is well, my A1C is down in a pre-diabetic range, so technically I'm not diabetic. What I like to talk about is if you have a blood sugar issue, you are diabetic. It's just a difference of where your A1C is at to put you in the diabetic realm. We see it all the time with patients that come in and they're on 3 different medications, and their doctor says, you're doing great, you have a 6.2 A1C. Well, you're taking 3 medications to control that A1C, so really you're still in the diabetic realm.
Yeah, one of the things that's just a myth is the fact that, just because you're down in that pre-diabetic range, which is 5.7 to 6.4, that the complications aren't still at risk. And so we want to make sure that we're getting not only the A1C down, we want to be doing things that are lowering the complication risk that diabetes drives. Okay?
Well, thanks for watching our video today. Make sure to click the button down below to subscribe.